Hello, my name is Megan Bory and I'm currently a student in the FSCJ BSN nursing program. I will be discussing the delegation and conflict management along with a healthy work environment. So part one will be the conflict. There is a CNA with 20 years of experience and is orienting a new graduate. The two CNAs are assigned to a morbidly obese patient who has been diagnosed with pneumonia and quadriplegia. Because of the quadriplegia, the patient requires assistance of 3 or more staff members. The unit is so short-staffed that the CNA is wanting to help the patient immediately who wants to use the bedpan. The experienced CNA wants to put the patient onto the bedpan without additional staff, just with the help of the orientee and herself. The two CNAs do argue in the middle of the hallway because of the haste of the situation. So part one, and the first step to conflict resolution is to attempt to distinguish any possible conflict prior to it actually beginning. You want to look for any body language, employee remarks, or anything that reveals itself that a possible conflict could arise from it. And in this situation, the nurse sees the two CNAs arguing in the hallway, and you want to de-escalate the situation. You want to do that immediately because it's inappropriate. You want to bring them to a private area where the two parties can be spoken with. And a win-win situation is always the goal of conflict resolution, and collaboration is a great way to have a win-win situation occur. So with this, the nurse can also help the two CNAs with managing the patient's needs because that's the goal of the experienced CNA. She wants to meet the goals and the needs of the patient. So the nurse, the two CNAs can all immediately go help the patient. So that CNA is satisfied, and also the other CNA is satisfied because there's safety involved. You need other people involved. And then the last step is you want to follow up. You want to make sure that the two are working well together and having a good shift together. There are also destructive techniques for conflict resolution, ridicule. So ridicule is described as intimidating others into doing their views on the conflict. And then there is also ambiguous questioning. So if you are in an argument with someone or a dispute with someone, and then another person or the other person that you're speaking with starts asking questions that are inappropriate to the situation, and they're irrelevant, you can always just direct them back to the situation that's occurring. And then flattery. So flattery is just flattering. You are complimenting the other person, and you're trying to make them feel more comfortable into your views. You want to bring them off topic to focus on something else rather than the issue at hand. So delegation is part two. So you are a nurse working on a busy medical surgical unit. You are assigned to 7 patients, and 2 of your patients are calling for assistance. One wants pain medication and the other wants to use the restroom. The patient requesting to use the restroom also has an order for a stool specimen. So you can delegate this task to a CNA to take that patient to the restroom, and that CNA is able to collect the stool safely, and you can attend to the other patient's needs. So there are 5 rights to delegation. There are 5: right task, right circumstance, right person, right communication or direction, and right level of supervision. Right task is described as one that is appropriate for a specific patient. Right circumstance is appropriate patient, setting, available resources, and other relevant factors. And then the right person. So the right person is delegating to the right task to the right person to be performed on the right patient. Ugh. So that is when the nurse is delegating this task to a CNA, and that CNA is going to delegate it on the right patient. There is right communication, and this is very important because you want to have clear, concise description of the task, including the objective, limits, and expectations. And then right level of supervision. So you want to do appropriate monitoring, evaluation, intervention as needed, and give feedback if needed. And then there are also delegation errors. You can be under-delegating, and that just means that you are unable to delegate due to false assumptions of the interpretation of delegation. So that may be interpreted as a lack of ability on their parts to do the job correctly. And then there is also over-delegating. So in contrast to under-delegating, you over-delegate. So you are, over-delegating, you're giving other employees your duties and responsibilities, and you're giving them jobs to do, and it may actually result from poor time management or insecurities about ability to do the task. And then there's also improper delegating, which is throwing off all the rights of delegation. You are delegating the wrong task to the wrong person at the wrong time for the wrong reason. And then there's also a healthy work environment. So a healthy work environment is described as, being supportive of the whole human being, patient-focused, and it's a joyful workplace. There are components to a healthy work environment. So you want to have skilled communication, true collaboration, effective decision-making, appropriate staffing, and meaningful recognition, and lastly, authentic leadership. So skilled communication can be described as being proficient in communication skills as you are in clinical skills. So you want to be important in both aspects of that. And then there's also true collaboration, which means to be relentless in pursuing and fostering true collaboration and working together. You want to work together as a team because a team is what makes the whole shift go so much better. Effective decision making is described as being committed partners in making policy, directing and evaluating patient care, and leading organization operations. Appropriate staffing, you have to ensure the effective match between patient needs and nurse competencies. You can't assign a nurse who is not competent in a task to a patient who requires that task. That's not very safe. Meaningful recognition, and this is very important to a lot of employees. They want to be recognized, and you want to be able to recognize others for the work that they do and the values that each of them brings to the organization. And then lastly, authentic leadership. You have to fully embrace the imperative of a healthy work environment. You have to live it. You have to engage in others and also its achievements. And then effective leader strategies to create a healthy work environment. In order to have a healthy work environment, you have to honor your individuals. You have to honor your employees and what they do. You have to value their inputs. You want to ask their inputs on anything that happens. You want to ask for their inputs on any new policies that you think that should transpire at where you work. And you want to regard their responsibilities, their values, and integrity. That is very imperative when you're creating a healthy work environment. And presently, where I work, I work on a family maternity unit, so I do labor and delivery and postpartum nursing. And it is truly a healthy work environment because it respects the culture and the employee values, and then also because of the healthy work environment, the employees enjoy coming to work. They enjoy coming to work, they enjoy working together because there's also skilled communication. They truly collaborate with each other because, again, teamwork makes the whole shift go well. And then meaningful recognition. They recognize others. They write emails to their managers about how well this employee helped them out during their shift. They give out jackets for prize customer service that happens on the unit, and because of that, it makes it a true healthy work environment. People are happy, and mostly because they're so happy, they stay there for a long time. There is not many turnovers. There's not a whole lot of burnout either because they staff appropriately as well. And that is the end of my presentation. Here are my references. I truly enjoyed this presentation, and I hope you have a good night. Thank you.